The MEC for Health today came in to unveil some state-of-the-art equipment. Can you please explain what equipment is that and what is its significance to the hospital?
Okay, thank you so much, and greetings to your listeners as well. I think before I explain the component about the equipment and what it is, it's important for me to give context. And the context essentially is that when we look at the performance of a health system, whether it's in South Africa, whether it's globally, we use what we call the World Health Organization 6 building blocks. Those are the basic principles that will reflect whether or not we're on track when it comes to rendering service delivery in healthcare. So human resources is one of them, drugs and medicine supplies, another, infrastructure is quite key to ensure we can actually catch the patients on time. And then we also look at governance and quality care, but now we talk technologies. That's also another one. And it's not just technologies in terms of equipment, but we also talk about IT in general, information and technology, because that's quite important to help us with data analysis, after collection and planning. So the significance of today is we've nailed it on the head when it comes to technologies for Steve Biko Academic Hospital, thanks to the Gauteng Department of Health. We have successfully managed to procure 2 MRIs, 2 PET scans, 1 angio suite, 2 cath labs, and about 4 Biko units, which are essentially X-ray units. And so, for the average person who's not necessarily in healthcare, they'll say, why are we complimenting a fish for swimming?
And what is that equipment?
And what is that equipment? But we're not complimenting a fish for swimming. In the first place, we're actually getting state of the art. There are various slice machines that you get, even with the MRIs and so forth. And ours is the top of the range slices. So you can actually see all tissues. You can see multiple parts of the body that you ordinarily wouldn't see with a normal MRI. And that speaks volumes to commitment in terms of giving service delivery to public healthcare, because we often have this misnomer that you can only get that if you go to private sector. With regards to the cath labs as well, to have 2 cath labs, especially in state. Even when you look at what we call acuities and the rent per bed day spent in private sector, once you talk cath labs, you need a cardiologist. You need technicians that are very good with cardiology. You need the radiographers, and then you need the state of the art machinery. And ours is biplanes. We've got 2 biplane machines. So that's huge expenses. We can look at the blood vessels. If somebody comes with chest pain and we think they might be having a heart attack or myocardial infarct, we quickly rush them into the cath lab. We can look at the blood vessels of the heart, decide if they actually need any additional intervention done by our specialist cardiologists. So that really is something really phenomenal, especially in this current climate where we have such a challenge with the fiscus. I really think that when it comes to what our MEC is gunning for in terms of really proving service delivery in healthcare, she really has put her money where her mouth is. And we really are quite excited. Bearing in mind that we are a teaching and a training institution over and above service delivery, and we're quite confident that the type of people that come out of here are going to come out very well equipped with the abilities to use state-of-the-art global technologies that really are life-saving. So it reduces turnaround time in terms of diagnosis, whether you're a cancer patient who needs to get oncology services, or an acute patient who comes in with back problems, and we need to look at, do we have a slip disc, what levels have been affected in your spine. Steve Biko is the place to be.
So you mentioned that this equipment is the state-of-the-art equipment. We're talking about playing into the 4IR. Let us look at the capability. Is the hospital capable? Does the hospital have a capable staff to operate this equipment?
Absolutely. When it comes to the human resource building block that I mentioned earlier on, all the doctors that you get out there, whether you're in private or even the general practitioners, actually come from a training institution such as this. So this is where the theory of medicine is developed. This is where it's refined, and then it comes out as an output of a doctor. So our professors are all here. The people who write the textbooks are all here. Those that train the doctors and or nurses to get out into the public are all here. So we absolutely have the human resource. The question, however, is do we have them the right quantity based on the current demand? And the answer is you can never have enough doctors or nurses. So that is certainly a challenge, especially in this day and age when you look at nursing. It's an aging population of staff, and very few young people want to get into it. But that being said, we still are in the position to render care, not only to the people of Greater Tshwane, we still deliver care to people from Limpopo and also from Mpumalanga and Northwest. So we really have a huge expansion of individuals that come from various parts that need the super specialized care that you can only get in a facility such as Steve.
Are mentioning that the hospital also caters for patients from outside Gauteng. How is this equipment going to help the overburden on the hospital?
By doubling the capacity that we have right now, I've mentioned that we've now got 2 MRIs with the same human resource, but of course we work in collaboration with our cluster. So even now we have radiographers who will come and do overtime here. So we still will have capacity to render the service itself. So doubling the equipment means we can now double the number of patients that we can actually assist with in terms of access to care, and have a faster way of having the diagnosis, reduce the waiting time because we've got more of the equipment itself. So this significant investment that really is at about the tune of 200 million for all these equipment really is going to assist in ensuring that we bolster access to care. And in this specific instance, we're talking about, radiology imagery.
You are mentioning the investment that goes beyond 200 million. And as the hospital receiving such equipment at that price tag, what does it mean to you and what is your expression?
It means you need to be very responsible. There needs to be clear maintenance plans. You need to take care of this equipment. You also need to take care of the human resource that's looking after this equipment. And we've got very specialized individuals. I mean, we've got clinical engineers who've got more than 20 years experience in terms of the equipment itself. It also means that you need to have the human resource that can train the individuals who will also learn to become experts over time. But also what is important is it also means that you've been entrusted with the responsibility of really spending money wisely on factors that actually count and factors that will really make a difference to the life of the average South African. And we are certainly doing that quite responsibly, very diligently, and remain very committed towards ensuring that we give the best to those who ordinarily would be kicked out of the system purely because they don't have the funds.
Thank you so much.
Thank you very
Cheers.
much. Thanks.